so I'm here today with Monica. She is a vet here in Kent, and she's going to tell us about a couple of specialist subjects that she deals with. So, can you tell me a little bit about what you do with dogs, Monica?
I work in a general practice, and I'm particularly interested in pain management. About in 2000, beginning of 2003, I've done an acupuncture course, and since then I've been treating with acupuncture dogs that had mainly pain-related problems. Acupuncture, it can be for following the traditional Chinese medicine, and therefore it has a lot of questioning about behavior of the dog, likes of the dog, and it is not so objective because the dogs can't reply to you, and it would be the owner that will tell you the answer. Therefore, I think that it doesn't work for me. So I follow the Western acupuncture approach that is mainly after that they had a diagnosis, find what they are, the trigger point. They are the points that are particularly sensitive, and when you do your examination, you will find that either you have a knot, or you have a response from the dog trying to go away from you.
Okay.
And there are the points that I will use for the acupuncture. That interesting is that they will be mainly on the Chinese median.
Okay.
And they will basically correspond to Chinese acupuncture points.
Okay.
And it has been researched that these particular areas, they do have a higher electricity field.
Okay.
So that's what I'm doing. Also lately been interested in the cold laser, that again, like the acupuncture, is stimulating the body to repair itself without having to introduce drugs that have a side effect that for some dogs can be detrimental.
Yeah, 100%. So how does the acupuncture work? What does it actually do to relieve the pain in dogs?
The acupuncture introduces a pain stimuli that it will run through the pain pathway that it has been established already.
Okay.
So it is like having a kind of motorway up to the brain. That's why painful area, they react to pain much quicker than an area that is not painful. It's because the connection between all the neurons and is quicker, and they learn the quicker way. When it gets up to the brain, because it's a different pain from the one that the animal is already experiencing, the brain will start to release endorphins.
Right.
And then the stimuli will go down to the muscle and relax the muscle. So with the acupuncture, you're not treating, for example, the osteoarthritis itself, but you will address the pain that the osteoarthritis has created away from the joint because the dog is not using himself in the correct way.
Okay.
So when you do that, you will have a dog who walks better, not because the osteoarthritis has gone, but because it has maybe relaxed certain muscle and released extra endorphin.
So it gives them some relief to be more relaxed and natural
and free.
Oh, good. And so what type of dogs do you see? I don't mean the breed, but what type of injuries do you see, or is it always Is it just old dogs? Is it any dog?
It is mainly old dogs, not because young dogs don't have muscular complaint, is because maybe people don't think that a young dog could be uncomfortable.
Yeah, very true.
And I've done in young dogs that had over exercise, or they've been used in kind of agility competition, where they use their body a lot, and they maybe had contracted a certain group of muscle that actually they benefit from the acupuncture. But mainly are old dogs that have osteoarthritis, mainly is backs and back legs.
And is that because of any type of, is there anything that causes more arthritis in dogs that we perhaps as owners are doing, that we perhaps shouldn't be doing so much of?
I don't know if there is a component of overusing it, or if there are the usual things that is the jumping up and down the coach or the bed or in the car, out the car. We're all guilty of that because it's difficult to stop a young dog that is fit to do it. But then as they grow older, they're less capable of doing it. And there are genetic condition that make cartilage in dog maybe going quicker than others. There are hip dysplasia, elbow dysplasia, in elderly dogs, spondylosis. There are a lot of things that somehow they will cause pain in dogs, and because they wag their tail and they are all happy to see us doesn't mean that they don't have pain. And sometimes it's very difficult to assess for an owner if their dog is in pain, because they only see that behavior and they think that it's normal for him or her.
Yeah, can understand that. And the laser treatment, you were saying that's more to do with healing, more of a, did you mean more of a wound type healing? Or?
Yes.
Right.
Thus it is, how I used it. So the principle of how it works, it is down at cellular level.
Okay.
So they've done studied and they, like plants, do react to the sun, a certain light wavelengths.
Right, okay.
And they produce the chlorophyll.
Okay.
Yeah. The animal cell, they do also react to the sunlight. And they find out that the infrared are making the mitochondria, that is basically the powerhouse of the cell, more efficient. Right. And if the mitochondria are more efficient, there is more fuel there, ATP, and that it will help the cell to deal with toxin, to get rid of, or to produce new blocks for building up and healing. Yeah. And on that principle, I've been using it on tendons, skin. So it is used in combination with stimulation also of the lymph nodes relating to that region. Right. So the lymph node drain better, and the cell can get rid of things.
Makes sense.
And that is it is something fairly new, but it is I think it is another tool that is not working 100% with everyone, but it is working together with all the other things that need to be there to make sure that a tendon or a wound is going to heal. So proper management of exercise or restriction of exercise, cleanliness if it's a wound, dressing, and all together, it may make the process of healing quicker.
Well, that's good. And so, obviously, a lot of people that were watching this may be trainers or owners of dogs. Is there anything that we should, as trainers, be able to spot? Is there any studying that you can suggest that people do, or anything like that for us to be more observant in our classes, on our one-to-one sessions?
I think that the Canine Arthritis Management website, it is a good point where to start. There is a session for professional and there is a session for dogs owners, and they explain what are the signs that you have to spot to see, that it will tell you that your dog is in pain or is uncomfortable. And I think that it is very good. They say that after 7 years of age, more than 50% of dogs, they will have some degrees of osteoarthritis. And then again, maybe it will be radiologically, you can see it, but maybe it's not painful for that dog. And someone else can have a much lesser lesion and be completely lame. So it is something that is depend. Dogs are very stoic. They don't want really to show much of a pain, apart from some that they're absolutely, unless they're dramatic, and then you look at them, oh! But so it is difficult, but we need to observe them. We need to spend time to look at them. And many times we are too busy to do too many things, and we forget about that.
And is there anything, so would you say that things like throwing balls and getting dogs running for frisbees and things like that will put a lot more stress on the body of those dogs? Because that seems logical to me.
Again, some of the game we do with the dogs are not designed really for dogs. Dogs, if you think that the dogs come from a wolf, they won't chase frisbee or balls. They will sniff around and search for they will run. Maybe the obstacle, they will jump it. But repetitive things are never a good thing.
No.
You can
Same
throw.
with us, I suppose.
Yeah, you can throw a ball once or twice, but if you do it over half an hour, probably it is not beneficial for the dog. The dog doesn't only need physical activity, it needs also engaging their brain. They're much tired if they engage the brain than if they just trot for 2 hours.
Yeah, 100%. And one last question, what about equipment that dogs are wearing? Is there any, you see arguments between collars causing lots of damage, harnesses causing lots of damage. Is there anything specific that you've noticed in perhaps the work that you do about any of the equipment out there not helping the situation?
I think that, the classic for me, it is the dog who pulls and is put in an harness, so it can pull even better. And it doesn't help the dog, it doesn't help the owner. I think that there are spaces for collars or harnesses. It's just that they need to be thought if it's the right dog.
Does the shape of a harness, though, affect?
Yes, they need to be fit properly. Otherwise, they will cause more damage than good.
Yeah. Okay, because often, we get owners coming to us and they want to use a harness because you can read out there that that's the best thing, it's the nicest thing, we shouldn't you know, be having a dog pull in a collar and things, but obviously
a dog should not pull.
Yeah, exactly. Dog should not pull. So sometimes, and I would often feel that sometimes a harness is not right for certain dogs in particular, for the fact that they perhaps are not fitted correctly, they're too loose, they're cutting across the shoulders.
Or underneath the armpits, where they do have all the lymph nodes and can be quite painful. They can restrict the thoracic, and then if they are running in it, they can't breathe properly. So yes, they need to be fit for purpose. And then again, you need to, the shape of the dogs are very different.
Yeah.
So a greyhound is a nightmare to fit on an harness, because you will never fit, because they're so deep in chest, but then there is nothing, very skinny.
Yeah.
So, you know, it's and the collar is nothing wrong in the collar. If the dog don't pull on the collar is perfect.
So basically, teach them how to walk nicely, and then whatever's fitted well is not going to affect their body so much.
Yeah.
Excellent. Well, thank you very much for your time, and I'm sure that the people viewing this will be very pleased to have learnt some stuff today, as I have.
I hope so.
So thank you very much.
You're more than welcome.